Across the country, millions of people are forced to navigate frustrating, complex systems just to access resources like food, housing, healthcare, and transportation. The resources we all need to live and thrive. All kinds of networks attempt to make it easier for people to get connected to these essential resources. At Health Leads, we call them community referral networks, and they can take a few different forms. There are networks where you can call a number and ask for help finding a food bank, or where a doctor's office provides a referral to a food bank and then calls the food bank to let them know you're coming, or where an agency might work with multiple organizations and resources at once on your behalf. But many networks are tackling only the surface-level symptoms of deeply rooted systemic racial inequities, and some of them are actually doing harm to individuals and entire communities. Billions of dollars have been poured into technology, seeing it as a way to fix all of these issues. But technology can't fix, and often just disguises the deeper roots of the problem. Communities don't have a say in how these networks are designed, how their data is collected, how it's used, or who profits from it. Say a new mother urgently needs help affording formula for her baby. A resource network makes an appointment for her at a nearby office so she can apply for benefits. They track this referral as a success. When she goes to the appointment, though, she's turned away because she didn't know she needed to bring proof of address with her. She's offered the next available appointment, which is a month later. But she needs help finding formula right now, so she has to start all over and try to find more urgent help somewhere else, like borrowing formula from a neighbor or a family member. But it doesn't solve her issue in the long term. The problem is that the data shows this referral was a success, and a select few people are going to use that data to prove the positive impact they're having on the community. Meanwhile, it's missing a key part of the story. But imagine if that network had been designed in partnership with the community and was ultimately accountable to them. They could review the data being collected and see ways to improve coordination for this new mother, her community, and communities of color that face the most barriers to accessing resources like these. Advocates could take that data and go to their local government and push for system-level changes. Things like more funding for benefits enrollment staff in certain zip codes, changes in the benefits enrollment process so it didn't require in-person appointments, or data matching so that someone reaches out to her via text before she even gives birth to let her know she's eligible for benefits. This is what we're doing with our partners and local communities all across the country, redesigning these networks so that they advance racial health equity at every level. That means improving their ability to help individuals access resources, ensuring they aren't harming communities, building in community ownership, and unlocking the potential of the data captured within these networks so that communities can advocate for changes that improve the availability of essential resources in the first place. Check out our website to learn more about how Health Leads and our partners are rethinking these networks.